Welcome to another season of Pro to Pro, where we sit down with entrepreneurs and successful business people and talk about their journeys to their success in their career. We go behind the scenes and have candid conversations with them and discuss health, relationships, fitness, and of course, business decisions, good and bad. If you're looking for inspiration, valuable business insights, and a dose of motivation, you're in the right place. Join me and my guests as we share our experiences, ideas, and stories that can help you on your own journey of growth and success. Welcome, and remember, keep it pro to pro. Welcome everybody to another edition of Pro to Pro. I'm here with my wife, who, if you all follow us, you know that my wife owns Elite Medical, and we're here to talk about a couple of things, and she has no idea what we're going to be talking about, which I enjoy. So I have a little bit of control over this. Welcome.
Thank you.
So I want to start off our conversation kind of talking a little bit about our trip to Orlando, where we were able to do a little bit of consulting and speaking for the Florida Dermatology PA Association, I believe it's the Physician Association. You got to speak about peptides. I got to speak a little bit about building a medical spa and branding and things like that. So I wanted to get your feedback on it a little bit, of what you thought about the seminar itself, the conference, and the synergy associated with it.
That was great. I mean, it was an extremely well-organized event. And I was honestly amazed that so many people stuck around to Sunday, because you know how it is when we go to conferences, that tail end is always like you're dragging. But I thought that everybody that attended was really well engaged, and it was just an enjoyable experience. And then I got kind of the added benefit of getting to be the injector for April, just because she's not licensed in Florida, for her presentation. So that was kind of fun too.
I forgot the conference started either Wednesday night or Thursday, and we were slotted to speak at least I was on Sunday, the last slot. You had 2 slots on Sunday, and there was people who actually showed up, which was incredible. You had a lot more than me, but still, you had a nice turnout. And what I found very interesting with regard to your presentation was the interaction and questions and answers in regard to peptides themselves and this anti-aging discussion point within the practice itself. Were you kind of shocked by the feedback?
Well, I was pleasantly surprised that so many people are embracing it and wanting to learn about it too, just because there is just such a profound health benefit to so many of these things that we have available to us. So that part was really nice, and just the overall interest. I wasn't sure how interested people were going to be in the discussion points, but a lot of them were very open to, the things that I was suggesting and my beliefs and how I practice with using peptides. But I just think it's a part of a bigger discussion, right, with transforming health. And I've also been very candid with people and shared that much of my own interest grew out of the things that were happening to me as I was aging, going through menopause and having those discussions with people. And most of them were women that were in there. I think there were like maybe 2 guys, but women, some in my age bracket, probably some a little bit younger. But my selfish motivation obviously was that kind of precursor, if you will, to saying I need to do something different, because the traditional things and the traditional guidance isn't working. So that was really, I was very pleasantly surprised at how many people seem to be willing to embrace recognizing there's a different way to practice and a different way to do things.
Well, what I found incredible was there's this sense of interest and desire to grow in the aesthetic field in that particular area, this health aspect. And it seems that aesthetic practices are trying to jump on the bandwagon and learn as much as they can about peptides and things like that. And I know you get a lot of drive-bys, so to speak, on social media where people ask you protocols all the time and, think it's just, take this magic injection and you're going to look a certain way. And there's a lot of interplay with regard to our lifestyle and what we do for our health and things like that. And I know that your desire to get into this field was predicated on a passion that you've always had in health and fitness.
Well, it was because I had always maintained a level of fitness, and then going through the process of menopause, obviously hitting 50, then getting past 50 and seeing these changes in myself to where I'm looking in the mirror and not recognizing who I am anymore. So, and what I was doing wasn't working. So yes, there was very much so a selfish motivation, and looking to colleagues in the primary care world and in the internal medicine world and not getting answers, It was never just, oh, it's your thyroid. Oh, it's just your shift in your hormones. So you do a little hormone replacement and that doesn't work. So I needed to peel the onion for myself to figure out that it's a much broader conversation that needs to be happening. And there needs to be a lot more work done to it. And it'll be fun when we have Nina, when you talk with both of us, because she experiences it too. You'll see so many influencers, like non-medical influencers on Instagram or maybe even TikTok, biohacking, do this, take this supplement, like trying to make it like there's some magic formula. And there's not a magic formula. There's a process that you go through. You have to test, you have to see. Remember when we did some of that in-depth testing for you, when we were both kind of shocked to see some of the areas that you were really deficient in? Sometimes because it's something that you didn't even realize was missing.
Yeah.
But it's not, there isn't magic to this. This is, you test, you figure out what's going on, you see what you're exposed to, whether it's toxins and mold, just like we did the mold testing today. There's so many moving parts to it, but it's not a magic. Like when people will, ask, well, what's your protocol for this? I really wish that I could say that there's a set protocol. There's guidelines in which you will operate, dosing ranges and things like that, but it's not one size fits all. You and I may utilize some of the same supplements or peptides or therapies, but how they're utilized for you is not going to be how they're utilized for me. So it's really not an appropriate, there's no formula to give to somebody. It's a process that you have to go through. You have to see what's missing, what's deficient, what ailment is there, where are they in life? It's a whole, that's why they take so long. That's why those types of appointments are so long, and it's such a huge investment for not only the provider that's taking care of the patient, but for the patient too.
What are some of the things that you think that people who are listening or watching us need to look for in a provider to just have peace of mind knowing that provider knows what they're talking about? Because you see, like you said, on these influencers and all these people on social media touting that they're experts and making all these recommendations.
I think that there's a problem across the board in anybody that says I'm an expert. I said a long time ago, as it pertained to aesthetics, what makes somebody an expert? You give an opinion in court and you're a certified expert. I don't think that anybody should be presenting themselves, I'm an absolute expert in this field. You can have done a lot of years, an OBGYN that specializes in reproductive health, that's been their whole career. That's you're going to say they're an expert because that's something that's solely all that they do. Or, a facial plastic surgeon, they're doing faces and, neck and faces all day long. So they're an expert. We accept that as expertise, but really what is it that says to anybody, well, I'm an expert injector, or I'm where? How do you come to that conclusion? So with functional medicine, that term being so thrown around, I think you want somebody obviously that's medical and that has a background in primary/internal medicine. And then from there, they've done advanced, whether it's integrative or fellowship. You want somebody that has expanded their education in those fields. But you're never, I always feel that when you say that you're an expert, it kind of somehow kind of gives this delineation of now you're done you're done with your education. And that's the bigger point. It's like you're never done. You're always learning. You're always that's the other part of it, of the equation. You need to be always moving forward, always educating yourself. And obviously that's a big part of my puzzle too, is I'm always learning.
Yeah. Well, I mean, you're always doing, you're training, you're going to different events, you've got a book open all the time, and the business itself, whether it be peptides or medicine, is ever changing. So you're always on the cusp, learning more and different things.
Because it is always changing. Just like we talk about just the vast amount of money that is made on people being sick. It's kind of one of those conversations where, why weren't we talking about this 20 years ago? Why weren't we recognizing that? I mean, you get lab reports and you're seeing the range of a normal blood glucose, for instance, is, all the way up to 99. A fasting blood glucose is considered normal. And I'm like, no, if you're even remotely in your 90s, you're inflamed. There's an inflammatory process happening there. So it's just, why weren't we having these conversations a long time ago? So I guess it's a good thing that we're having them now, and we're recognizing how important it is to maintain health and to value health much like we value, material things. And it seems like people are shifting that. They're recognizing it's far more important that I have my health than I have, tangible things. It's just shifting the focus. I mean, that's at the end of the day what the most important part of this is, shifting the focus and being open to recognizing there's better ways to obtain your health than in a pill.
I think that, what I talk about and what seems to resonate on the social media platforms that I'm on is this concept of, things aren't going to make you happy. And, unfortunately in life, we focus so much on attaining things and career, and we lose sight of health. One ends up eclipsing, taking over for another. In your practice, you see all different, demographics. You see all different types of patients that come in at all different parts of their lives. Is there anything common that you think that you see with regard to your patient base that seems to be, resonating in today's world that you've been able to observe?
I think that if I had to say between men and women, younger, older, the pandemic changed the way that people looked at health. I mean, we're still not where we should be with health. I mean,
what do you mean the pandemic changed the way?
Because there was all of a sudden this, you had, subgroups, vaccinated, not vaccinated. It became, health became such a polarizing topic. And I can remember even then, well, are you vaxxed? You're not vaxxed? And thinking to myself, man, it's like, would you walk up to a woman and say, did you get your pap smear? It's like, it was this weird thing for me that all of a sudden it was, you were put in a category as being normal or not normal if you did or you didn't get vaccinated. So it changed people, at least my observations with my patient population, is people became more aware of the importance of their health, and the importance of prevention, and being in the best health that they could possibly be in. Because the one fact we all know is pretty much everybody's had COVID at this point, right? Vaccinated or not vaccinated. So I think that that's the one common theme, and recognizing, having conversations with people that a lot of what goes on inside will manifest itself cutaneously. So you'll see it on their skin, poor skin health. Will give you like a window as to, well, there's something not right on the inside. Acne, we've known for a long time, we got to get something fixed on the inside. That I think was a point of change for me, because it was like 2020 happened, and then there was this shift because that was the year I also turned 50. So that was the shift for me too, was recognizing, the health and watching what we went through. Because I kind of didn't give you a choice, really, because it was like I was going to make these changes. So I said, well, you have to too.
Yeah. Because
it is really hard if you have somebody that has a very mindful, healthy approach, or wants to have a healthier approach with foods and things and living, and then you have a partner that doesn't. We talked about that, because during the pandemic, you and I were like, 2 bottles of wine a night. And it was like, oh, what winery are we going to go to tonight?
Isn't it interesting, when we talk to other couples, that a lot of couples got into that rut or got into the same habits during that COVID period. And then, fast forward into where they are now. And a lot of them, had this aha moment also. I don't know if it's an issue where you tend to attract more people who are in line with your thought process, because it appears to be, at least from my perspective, what I've seen is that many more couples are cognizant of their health together and want to live longer and enjoy their lives together. So they're seeking out people like you. I get countless requests. What are you taking? Please, can you help me with the diet? What do you do for your exercise? I mean, you look so good. I get the same junk about PEDs all the time and all the nonsense and things along those lines.
Well, I always say that it's going to be the trolls or the people. It's easier to look at someone like you and say, oh yeah, steroids. Because it's easier to do that, to diminish what a person invests with their time than it is to acknowledge, wow, that's the result of discipline and hard work and commitment. But and with that, I also say, because people seem to think that to have and to attain this, that it's like you must be miserable, you must not enjoy any part of life. And that's really not true. Because there is still a huge part of, like, I think I'm a foodie. I love food. I just make different choices. And, you love food too. So it is not a life of deprivation. And I think that that's the other interesting thing that I've noticed in this shift. And I always say post-COVID, because that was when we started to make these changes. It's that people are so extreme. It's either you're all in and you don't have any sugar, you don't do, I get it. This is what I tell my patients that are going to start a journey. I tell you, hey, no seed oils, no refined sugar, no, only non-hybridized wheat. I do tell them and give them kind of a list of things. I send them links for different diets and whatnot and better ways to eat. But I also tell them, you're human. So I do want you to enjoy life. But it's just doing it in moderation. And that's the point. Like, we have people that are either completely garbage eaters, or we have people that are completely on the other side of it. So it's just, it seems that we can't find a sweet spot. People struggle finding a sweet spot for themselves, that they just have to live this life of complete deprivation or completely.
And that will create failure. You cannot sustain,
right.
One or the other. So I think that's an interesting point that you bring out, because that's what gets people off the train again, because it's too much. And I always tell people, start slow, baby steps. If you go into the gym and you do a full body workout and you haven't done it in years, you're going to be sore, and that's going to, you're going to be dissuaded. You may not want to go back again, because you're going to be in pain. So you have to take things slow.
I have a patient that I take care of who is overweight, and she has terrible knees. She has no cartilage. Or maybe just a bare minimum of cartilage. So she's seeing some type of regenerative provider who has told her, well, let's do PRP injections. And, to the tune of like $3,000. And I looked at my patient when she was telling me this, and I said, well, what about losing the weight first? Because then you'll ambulate better, and your joints won't have so much pressure, right? I'm dumbing it down in my own mind. And it's going to be a lot cheaper. You do some semaglutide or some tirzepatide, get that blood sugar under control, lose that weight, you'll have better ambulation movement. Oh yeah, I don't know why she didn't suggest the weight loss. She said that if we got some cartilage back in that area, we regenerated, then I would be able to move around better. So there's just I don't get the thinking of. I think there's a huge monetary drive with a lot of this too.
But it's issue management. It's immediate management to that one particular area, rather than looking at the bigger problem. That's exactly what it is. You went to the bigger issue, and so what's causing the entire issue, rather than let's just deal with the immediate issue in front of me.
But I also think it's very money driven.
Of course it is.
So that's the other part of this. When you're trying to counsel somebody on how to find a provider that can help guide them. Obviously, you want to find somebody that has the experience and that has your best interests at heart. I always say find a provider that's as invested in your success as you are. But it also comes down to just finding somebody that isn't just in it for the money, because that I'm seeing more of, especially in our area. It's the money, because everybody's doing it,
So one of the things that I recall that you spoke about at the conference was the GLPs, specifically tirzepatide, and what was the other ones that you? Semaglutide.
Or semaglutide.
Yeah, the semaglutides. Right. And there's a lot of discussions about these medications, and you talk about polarizing. It goes all over the place with it. But what I did find in very interesting was the desire for at least the people that were in your session wanting to learn about it.
And what I was excited about is that some of them were already using them in really great ways, not just because that's the other part of it too. I really hate this whole thing like weight loss. Yes, okay, let's get you to a healthy weight, but this is about longevity. It's about optimum health. I've been referencing since Jim LaValle had talked about it, and I read it, that retrospective study that was like 2008 to 2018, and it had something close to 40,000 participants. So you can deduce that that's going to be reliable information. And for every point above 90 that a fasting blood sugar is, you have that 9% increase of developing diabetes. And I can't tell you the last time I pulled fasting labs on a patient that didn't have a fasting blood sugar above 90. Some as high as 101. So I'm looking at it, and this is what I'm always trying to do: follow the path, extrapolate that to your 30, 40 now. Your body compensates, right? Your body compensates. So there's stuff happening inside that you don't see, that you don't feel. You might get aches and pains because you have some inflammation, but you don't see what's happening into these peripheral beds in the body, and what this chronic inflammation is going to do. So you walk around and you're fine, and then all of a sudden you're like late 60s, and you're starting to forget things. Type 3 diabetes, Alzheimer's. It's like we are not going to be well because we've been living our lifestyle a certain way, and our blood sugars have been not great. I don't like anybody to have a fasting blood sugar above 85. And the scary part is most people don't know. I get medical updates every night, and I get this thing where there was a physician saying, encouraging your patients to do continuous monitoring, even on a trial basis, is such a bad idea. And I'm reading the article and my jaw's hanging open because I'm like, why? Why is it a bad idea to encourage our patients to have more knowledge about what's going on within their body? Get that glucometer. See what your 1 hour postprandial blood sugar is. See what your 2 hour. The more information, the better. The more information I have, the better for you. So it really irritated me when I read that, because I would never, ever encourage a patient to not know. So it's just, I was excited at the conference because there were a lot of providers that are already looking at how they can use these, the GLP and the GIP dual agonist in ways that benefit patients that they're really not talking about. OCD, addictive disorders. There's a lot of benefit to it, and when it's done properly, your patient is going to be okay. The fear mongering that went on about it, and then they came out and said, "Oh no, it doesn't cause, pancreatitis as much as we were thinking originally." The annual meeting for anesthesiologists, they came out and said, "Yeah, if they're on it, they need to just stop it a week before." I mean, all the fear mongering that went on around about it, I think, had to do with big pharma.
Probably, but there's also there's continued fear mongering that I want you to dilute. One of which is this concept of that, you're going to lose all this weight and you're going to lose all this muscle, and then when you go off it, you're going to rebound, and you're not going to have the muscle to help burn with the body. So your body's going to be so out of composition.
Well, you do lose muscle, and that's a conversation that you have to have with your patients, because sarcopenia and osteopenia, it happens to men and women as we age, and that is why it is important that you're doing weight resistance training. When my patients get worked up, they have to do those in-body scans, and I am looking at their muscle to fat ratio. And if they hit a threshold that I'm not pleased with, they're not going to continue. because that tells me that they're not ingesting the amount of protein that they need.
So let's go back, because this is an important part. People get on this medication, and many of the people that get on it, say they're severely obese or at a point where they have unhealthy habits, whatever they may be. So they get on the medication and they're losing the weight. The issue that I have with it, just as you mentioned that you counsel your patients, is that these individuals are devoid of any healthy habits to begin with. So if they're on this medication and they're losing the weight and they're losing the muscle, and they don't know the difference as far as protein, they don't know the difference about weight, doing exercise and things and they don't do it, then they're going to be walking skeletons. Then they're going to be unhealthy creatures because they haven't made changes other than injecting this medication in their body and not wanting to,
But you would think that would be the most simple thing to understand, right? You really would. Common sense, but it's not.
It's not.
So right. So it has to be there. That's why I get so many inquiries for it all the time. And I don't work like that. There's a whole protocol that has to happen before we implement any peptide. It isn't just that you call and you and listen, that's fine. I'm sure that they go down the road and they get somebody that will give it to them, or they go through the TV. You see all those ads all the time now about getting on those things. That's fine. It's not going to change how I practice. I mean, using BMI, which I don't really like to do because, pulling a leptin on somebody is a little through their blood is a little bit more of a reliable indicator of that. There's so many ways that you can assess a person's overall health that doesn't make it that complex. You do the workup, you educate them about the importance of retaining their muscle. And if they don't, then you don't keep them on the peptide. I mean, you have to be a diligent provider if you're going to be prescribing. The same way that, we had conversations about the overprescribing of opioids, and we talked about the limitations for physician associates and nurse practitioners. But there's a huge responsibility for those that the physicians that are physiatrists, right, that are pain management. They have check marks and boxes that they have to make sure they're filling to write those scripts for those people. But it's the same thing. You just have to be responsible with how you're practicing.
Well, I think unfortunately these GLPs have come out at a time when we're in a society of immediate gratification. Period. So this is this apparent lightning bolt, or this is this concept of having these GLPs where it's the magic bullet.
But there isn't, though, and that's the point.
Well, people think it's a magic bullet, and there is a benefit in weight loss in taking it. But if it's done in a vacuum, what I'm stressing to people who are listening or watching us is that, if you're going to take this stuff or you're going to prescribe this stuff, you have to have the approach that you have with regard. It's got to be holistic. It even goes to the point of, lifestyle changes, not just dietary, but like the exercise piece that you suggested. If people have never exercised to begin with and are overweight, in many instances could be because their lifestyle is that way, it's a complete mind shift. So it's going to require, a deeper and introspective analysis when you get on this stuff. It's not just go to your provider, get some of this stuff, get some counseling from your provider. Okay, now I'm going to go in a gym. I mean, it doesn't work that way.
No, it doesn't. And I think that I've been fortunate because most of my patient population that are enrolled in the program are in that whole lifestyle transformation. They're not just, I just want to lose a little weight. I have patients that hit their goal, and then we move to microdosing to maintain that health benefit. But that's still a monitoring program too. I'm still having to have them follow certain rules. The other part of it, I get appalled when I still find out they're prescribing things like phentermine or Adipex. It's like, that medication has such implications for the heart. And you want to argue, providers want to argue and say that GLPs are bad. No, I'm sorry. That is probably one of the safest ways you're going to get somebody to drop weight and to be healthier. And it's all baby steps. I have patients that just come in for using a GLP-1 or the dual agonist because they've just gotten a trainer. They want to get healthy, and it's baby steps. Then they come back and they start to see the shift with their in-body, and they start to see oh my gosh, my skeletal muscle went up 5%, or I've lost another 5 pounds of body fat. My visceral fat, wow, it went down from, 18 to 12. And they start to see those changes. And then they're like, okay, what can we do to help support my muscle? So then we start going into those conversations. We're looking at their IGF-1. We're looking at their hormones. Your testosterone's 9. You're not likely to have that kind of stamina. We need to look at that. It's a constantly moving program. It's never stagnant. And it's a huge commitment, but
well, it's your health. I mean, what else?
Think about the time people will invest binge watching a show on Netflix
exactly.
or eating crap food. Make the commitment to change your life because it can be over in a second,
I talk about the money grab. I talk about people chasing, their dreams in a career and doing what they have to do. And they always put the health aside, or they'll put a relationship aside, whatever it may be. I think as we're living longer in life, and people are gaining more knowledge, and as medicine gets even more advanced, there's opportunities for people, and I think people are opening up their eyes. It's just a question of how they approach it and how they handle it with themselves.
As both a provider and a consumer of healthcare, listen. I'd love to live a long time. Right? I would love to be here a long time, but I don't want to be here a long time if I don't have all of my cognitive function. So my goal is to preserve my mitochondrial health, to have all of my synapses firing, because I don't want to be in a long-term memory care facility not knowing who my children are, And that's just me. But when you look around, that's a huge moneymaker. Assisted living, memory care facilities, because when you then back that up and you look at it, I'd be willing to go out on a limb and bet that all those people had blood sugars that were chronically high. Because guess what is a fact? Insulin resistance. You get older and it happens. So I don't think that we should be willing to take anything off of the table when it comes to patient care. I think it just is between the provider and the patient, and you have an obligation to first do no harm and to take care of your patient. And that's the most important part of that equation. But it's between you and the patient. I don't think anybody should be coming in and telling me how to provide care for my patient or what I can be able to use for my patient. When the FDA recategorized all those peptides, we still have, there's like thousands of them available to us, that are out there. But I sit there and I'm like, okay, all these polarizing topics of what the government should be involved in and shouldn't be involved in, but we were okay with them telling us we couldn't use certain peptides for our patients. Cerebrolysin for people with like neurotrauma and PTSD. I'm looking over here going, wow, we really don't have a balance. We don't want the government involved in some things, but we want them involved in this, telling how providers, how they can practice. So it's just, again, political topics and things where I don't think politics has any place in medicine. But, that's a topic for another day, I guess.
Two quick topics. One thing that you mentioned that I think is important, and I'd like you to talk a little bit more about, is this microdosing concept with regard to the GLPs, and then we'll go on to something else. I brought up the point about, this finding that if you go off immediately, and I'm noticing in the feeds and in social platforms that people are talking about their experiences and going off and what's happening with some people about it. What's your thoughts about this microdosing versus going off cold turkey versus
well, people that are going off of it cold turkey, I guess I just am curious as to why, right? Because
well, some people may have wanted to, I had a desire to lose 40 pounds. I lost my 40 pounds now. Why should I stay on it?
They don't have to. And that's something that I do say, like, it's a choice. But you can use varied dosing and find a sweet spot for a patient that keeps that weight off, but it's not the same dosing to continue to lose weight. So not everybody's going to be the same. You find out what works. And that's why, again, it's important that you're aligned with a provider that is responsible and that you have a good rapport with and that that's guiding you on the journey.
What's some of the benefits of the microdosing?
All the stuff that we just talked about, insulin resistant, sugar, blood sugar is chronically inflamed. The common theme I hear from my patients are like, wow, I just don't feel as inflamed. I don't I haven't had issues. I don't have the same food noise, So there's a lot of other variables to it. A lot of my female patients have OCD and take medication for it. They've been able to not take that medication, and they don't have the same type of OCD symptoms. So it's just finding the sweet spot for the patient that works. They have to do a commitment with, certain lab work at certain periods of time and going from there. It's not one size fits all. So that's why I when people will DM me and ask me things, I'm sorry, I don't know your health history. I can't tell you precisely what would work for you, nor would I, because obviously they're not my patient. But it's just not a one size fits all,
You also mentioned, though, I think that some of the GLPs are used for other things, and you referenced it earlier. I think in part, isn't it an issue for smokers too, or
it's addiction? Things that are people that are typically heavier drinkers are noticing that they don't have that same drive and urge to drink. Smokers are noticing that I've had women that have gone from 3 packs a day habits to 3 or 4 cigarettes a day, and they're working to quit. So there's other health benefits to this.
Talk a little bit about the interplay between the aesthetic side of your practice. In other words, your Botox, your fillers, and your skin treatments on the derm side, and how it interplays a little bit with this functional medicine side that you've developed a passion for.
Well, as I said earlier, what happens internally will ultimately manifest itself cutaneously. So here's my question for you. Why are you going to spend thousands of dollars lasering and putting filler in your face and treatments if your health is crap? I mean, seriously, that's my question. It doesn't make any sense to me. What's the popular phrase there? He says, the math isn't mathing. It doesn't make sense to me. Heal from within. Beauty from within. I mean, that's a little moniker, but that's the truth. You get yourself healthy inside and then make those investments to keep yourself looking and feeling your best on the outside. It shouldn't be backwards. It's like, I love the reference that I've been using lately with Stranger Things. It's like you're living in the upside down. Yeah. Fix that from within, get those things right. Your gut health, your HPA axis, get everything in line. And then the rest can help, the rest can fall in place. It's just, I'm moving away from the push of fillers. We need to be approaching things from a more natural perspective. And my personal belief, and it's not everybody's belief, and that's fine, is just, I believe that starts from within.
Have you noticed a trend in the practice for people not being or not wanting to be so exaggerated in their look?
I've never had that issue because I don't treat patients that are exaggerated. My patient population tends to be a population that embraces subtle, natural, and that's always how I practice. If somebody comes to me and they're over-exaggerated, we have a conversation about diminishing that and reducing that.
Well, we talked a lot about GLPs and, the segue from the conference and everything that went on in your practice and things like that, but I think it was very informative for people who are listening and watching, and I appreciate you taking the time to talking to us about that. I think the dogs are driving us a little cuckoo, and it's time we got to end this right now.
They're letting you know.
They're letting me know
it's cut time.
Yeah, it's cut time. So everybody who's listening and watching, we appreciate it, and thanks again for watching Pro to Pro. That's all for today's episode of Pro to Pro. I hope you enjoyed hearing from our guests and gained some valuable insights into the world of entrepreneurship. Like and subscribe to stay up to date with the latest episodes, and don't forget to follow us on social media. Thanks for watching and listening, and remember to keep it Pro to Pro.